So now my posterior wall has become interior, so everything is under vision. The trick was that I brought the this 12 o'clock suture anteriorly to my 6 o'clock and the 6 o'clock suture posteriorly to the 12 o'clock. So the whole suturing sequence can be done under vision. Again, remember that this cannot be done when the vessel wall is too small or you have a basically fragile or not so good vessel wall. Hello everyone, welcome back. So in Vascular Anastomosis course, this will be fifth video, and in previous four videos we have already talked in detail about how to do arterial anastomosis with different techniques, what are the theoretical rationale and what are the variation from interrupter to continuous technique. And in this episode, we are going to demonstrate that how to do continuous arterial anastomosis with single suture and its variation of flip. So it is highly recommended that you watch our previous four videos if not watched already before joining us here to have a comprehensive understanding of every technique, because the things we have already discussed in previous episodes we are not going to discuss in detail, and you may miss the vital clues if you have not watched our previous videos. Please read the detailed disclaimer description, and these videos are meant for education purpose and information only, and it's not a substitute for professional training and professional advice. For an exclusive and early access to our premium high definition content, viewers can download our app available for Android and iOS, or can join the channel membership. The link for everything is given in the description of this video. The basic setup for vascular anastomosis, the basic instrument requirement, the do's and don'ts, everything has been covered in detail. And as I said earlier, please watch our previous videos to have a basic understanding and to have a comprehensive understanding, so that you have a gradual build-up of the knowledge. So now let's start with this video, that is vascular anastomosis with continuous suture. That will be episode number 5 in arterial anastomosis techniques. So friends, the basic setup, the basic requirements are same. We started with the double arm vascular suture, that will be 5 or 6 or 7 or depending on the vessel length. We came inside out from both the ends. That will be your farther end, or for the simplicity's sake, that will be 12 o'clock end of the two ends of the arteries, and then we tie these knots. In previous episode which we have demonstrated, we have not tied the knot, we have kept that knot and taken all the sutures in a parachute technique. So this is another variation, so I am discussing different variation. You can follow, try all those, and I mean one size will not fit all, but you got to master at least one technique, and you should know all the techniques, but because in different situation you may require different adaptation. So after tying this 12 o'clock knot, now I will start suturing the posterior wall under vision. So as I said, it is will be very helpful if you work under some kind of loop magnification. I usually recommend it, but I practice is 3.5x loops. And if you're not into transplant surgery or microvascular grafting, then 3.5 is, I feel is sufficient for most of the arterial anastomosis which a general surgeon, trauma surgeon or GI surgeon will be needing during his career. So again, Castroviso, fine vascular forceps, everything is handy. And whenever we are doing the continuous arterial anastomosis, you need some sort of a good assistance, because as I said, if there is single mingling, then you may have to do the whole suturing again. So again, see here, this is one important step of continuous suturing, that I took white, I tied this knot, then I came from outside in on the efferent loop. That the efferent loop is on the left side of my hand, So I came inside out and I came close to the knot of the previous suture. So this is important, friends. I have given this as a freeze frame, because if I come outside in on the afferent limb, that is on the right side of my screen, then that will lead to the horizontal mattress suture, and then that will lead to leak. So this important point you have to keep in mind. So I came, both the suture were outside. The right hand suture, I came outside in on the efferent limb, and then it is simple. Under magnification, somebody will hold this suture under tension, as I am operating alone here. So I am facing with difficulty. Otherwise, in the real life, there will be somebody who will be there to help you out. So again, I am inside the lumen. So on the afferent limb, I am coming inside out, and on the efferent limb, that will be outside in, and this sequence will be repeated throughout the this anastomosis till we reach the near end, that will be 6 o'clock. For the sake of simplicity, the end which is closer to you will be 6 o'clock. Again, friends, and whenever you're doing suturing, whether it is skin suturing, gut anastomosis, vascular anastomosis, or any kind of suturing, it is always advisable or easier that you do suturing from farther end to your side, so that this suturing will be easier. If I go from 6 o'clock, that is the near end, to the farther end, then suturing becomes difficult. So any suturing, skin suturing, sheath suturing, it is always helpful when we come from the distance towards your side, that is the farther end, to the closer to the operating surgeon side. 2 to m distance, 2 to 3 mm distance from the margin. And the one benefit of the continuous suturing is you can take more bites, and whenever you are doing this grafting with the whenever you are anastomosing the graft with the artery, or you are anastomosing two graft together, so the chances of leak are higher because they don't oppose well. So in that situation, the continuous suturing is more beneficial or more helpful, and that lead to more hemostatic effect and lesser bleed from the suture line. Try not to take all the suture at equidistance from the cut margin, otherwise that can shear the wall. So say I have taken one bite at 2 mm, next bite 3 mm, 2.5, so on, so that all the sutures had some different distance, and we don't cut through the whole wall at the same distance. So with that, I have reached the end of the other end. So I started from outside, and I will leave the needle at on the outer side, on the this afferent loop side. You can just see in a short. So you can always pull at the end and see how beautifully it will oppose. Keep practicing, my friends, and that will be the whole guide. These videos are just a simple roadmap, but ultimately it is the practice that you do on these kind of grafts or on the cadaveric vessels that will add a real mastery to your skills. Try to take as much posterior wall as you can. So inside out, outside in. So I have reached quite a healthy distance on even the posterior and anterior wall. And I hope with these small demos, these videos will help to basically sharpen your skills, and you will be able to do the suturing in a better way. So I have left my suture on the outside on the afferent loop, and with the other suture, now I am starting the suturing on the anterior wall. Simple technique, friends, nothing very much. Only technique, one thing that you have to keep is that the first bite you have to come on the afferent loop and toward the horizontal meta suture. Again, outside in, inside out, continue this way. And again, there can be different variations, like you can suture the anterior wall in an interrupted manner also, or you can start with a fresh suture to avoid the bursting effect. So there are different variations, and you can adapt as per the vessel wall, as per the condition, as per the expertise available, and as per the requirement of the need of the hour. Here I'm using maybe fiber suture, but in real life it will be even finer sutures, that will be 6 or 7 depending on the caliber, and you continue in a similar way. So with that, we have completed all the arterial anastomosis technique on the PTFE graft. There will be some videos which I have recorded during the live demonstration of the cadaveric basically and porcine vessels. So that may add some more insight and real time feel to all the viewers. So that will be we will be uploading soon. So stay tuned. So with that, our arterial anastomosis is complete, is perfectly aligned. And as I said, don't try to take more sutures. You can cover the suture line with some kind of vascular these hemostatic agents like BCS cell. So you can keep it around the vessel wall. Don't try to compress or take more sutures. Minor bleeds and ooze will stop at their own. So in this series will be venous anastomosis. Before that, we will also upload the cadaveric demonstration of the arterial anastomosis to have a more comprehensive understanding. And do remember that this continuous suture techniques is required when time is critical, like trauma, limb salvage surgery, vascular surgery, rapid revascularization essential, or during the transplant surgery to reduce the warm ischemia. So if you intend to go into a transplant field, then this is one must know technique, and you will be doing much better than us. So advantage small to medium caliber artery, especially when lumen needs to be preserved with minimal irregularities, provide smooth intimal approximation, lowering turbulence and risk of thrombosis. These are again advantage of the continuous anastomosis. And for synthetic grafts like PTFE and Necron, continuous suture provides better seal against bleeding compared to the interrupter sutures. So it's more beneficial and recommended in those kind of sutures when you are doing the anastomosis between the artery and graft, or between the graft and graft. So interrupted this continuous anastomosis is even recommended when you are dealing with high flow vessels like carotid, renal, or iliacs. It prevents stepwise gap that may occur with the interrupter sutures, because you may be taking a suture different distance, so that can be that can lead to step formation and turbulence. The continuous suturing is comparatively simpler once you start running. The simple inside out, outside in, and continuous suturing avoids repeated knot tying in deep and narrow fields while taking the posterior wall sutures in difficult scenarios. Also, this technique is helpful. So, what are the disadvantages of continuous suturing? It cannot be done when the artery is fragile or diseased arteries like atherosclerotic, irritated, or inflamed vessels. Interrupt is safer as it allows localized adjustment. You can take more bite if the previous bite is less. So, as I said, the interrupted sutures are ever correcting, and even in long anastomosis under tension, there is a risk of bursting effect if not done carefully with the continuous suture technique. So rest of the points of the theoretical part: clearing the adventitia, holding the vessel gently, don't hold the intima, always hold the adventitia. We have already covered. So do watch our previous episodes in this series, and to have a better understanding of the subject, and some of these thumbnails I have placed here. So viewers are requested to watch all the videos in this series and other videos, high quality videos we have uploaded on our app and on our YouTube channel. Keep practicing, friends, and with that we have reached the end of this video. I hope I was able to add some new insight to your knowledge, and you will be able to do a vascular anastomosis in a better way after watching these videos. Keep practicing. Remember, those who sweat more during the peace, they bleed less in the war and in the operation theaters. So with that, thank you very much, friends. Stay tuned. Happy learning.